conference. Until the president takes the podium, I want to bring in our medical experts now to talk about things with us. Dr. Natalie Azar is an NBC News contributor for our medical stories, and Faiqa Cheema is an infectious disease specialist at Hartford Hospital. Ladies, welcome to you both. Dr. Azar, your sense right now is what on how our coronavirus response is going? Are we actually doing enough to start flattening that curve that we've been talking about?
You know, Alex, to the point of the communication that's coming from the president, that it just needs to be consistent and it needs to be accurate. You know, just speaking personally, I can tell you that you know, that there's been a shift even within New York hospitals from the last week, where there was an expansion of testing offered to those individuals who didn't meet criteria for hospitalization or didn't require hospitalization, to now we're finding out that, you know, hotspots like California and New York by the end of next week may no longer be doing that and only offering testing to healthcare workers or for those individuals who are sick enough to be hospitalized, not just because of the availability of the tests, which are clearly inadequate, but also because every time a test is performed, the person performing the test has to wear personal protective equipment. And so are we testing young, otherwise healthy individuals because we want to know from an epidemiological point of view the prevalence and the true rate of infection in the community, and to safely say to those people, you do need to isolate? But we're testing these young folks who actually, it may not change their management. So now a decision is being made. We're going to sacrifice the public health or the epidemiological information because we need these tests for the healthcare workers at the front lines and for those individuals sick enough to be hospitalized where it could change their treatment. Yeah.
I'm going to get to you, Faiqa, in just a moment, but I do want to check in, since it is the bottom of the hour, of one with NBC's Kelly O'Donnell. She's standing by for us at the White House. Kelly, any indication when this briefing is supposed to start? As you very sagely mentioned before, based on the experience, they may say a 12:30 start, but it often is late.
No update so far on the timing. 12:30 is what they updated us after having moved it from noon. What we do notice that's a little different is there are video screens that are a part of the backdrop today. We've used those in previous briefings where the administration wants to put out information that can be in sort of a visual tool, and so perhaps that's part of the plan today. We had not seen that in other coronavirus task force briefings to date, so that might be a bit of a clue of what's coming. The topic and specifics to be determined. But we are here in the briefing room. Again, we have had a second round of temperature checks. All of us were tested for temperature as we entered the White House gate today, and then a short time before we convened for our places here in the briefing room, we were checked again. That presumption, of course, is just making sure no one shows a fever if they're going to be in the presence of the president, vice president, or the other members of the task force. And certainly it's a benefit to all of us amongst ourselves who are also doing lots of extra cleaning and wiping. This briefing room has not been wiped down this much in its entire history. So we're all taking steps to do that. And so there's a positive side to the temperature checks as we wait for the updates from officials today.
Yeah, very curious. I remember last Saturday, right about a week ago this time, Kelly, there was one journalist who was not allowed to enter the briefing room because of that temperature check. Anybody turned away today?
Not that I am aware of. And we also, of course, have seen how different news organizations, just like every other kind of workplace, have put limitations on how many people they're sending. So we have a smaller footprint than we typically would. Of the 49 seats here in the briefing room, we're going every other as one other step to try to give a little extra room. It's not 6 feet apart, but it is more social distancing and spacing. And because of that, the news organizations that are chosen to be here, in my opinion, have a greater burden to make sure we're asking a wide range of questions and having many questions available so the public gets the most out of this briefing, in addition to those journalists who can't be here because of the new seating chart. So we're all in some ways effectively working under our pool rules, where we work on behalf of our colleagues for the benefit of the public. So I think there's a greater burden on those journalists whose day is today to be here, to be ready with those questions when officials are before us. Alex?
Well, they say we're all in this together, and clearly you are working collaboratively. extensively with other news organizations. Kelly, thank you so much. I know you'll let us know when the president and or vice president, those members of the task force, get to that podium. Thank you for that. Right now, I want to ask Dr. Azar one more question, follow up to what you were saying. It was kind of percolating in my mind. Not sure if this is a completely PC question, Natalie, but when you talk about those who need to get those tests, if somebody has a mild case, or if somebody is curious whether or not they have it, they're showing some symptoms, but they are not severe, do they need to get a test to confirm it? Does it come into maybe almost a mental health issue that they want to know they had it? Does it at all affect the way they would treat themselves by self-quarantining at home and taking Tylenol and the like of the over-the-counter medications?
Right. Yeah, that's a great question, Alex. And I think we are getting to the point now where, doctors and healthcare professionals who are taking care of patients are saying, if you come in with a flu-like illness, fever and cough, as flu season is now receding, you can assume that you probably have COVID-19. And if you're otherwise reasonably healthy and not elderly, the advice is to stay at home, to isolate, and manage your symptoms the way you do with flu, which is rest, fluids, and perhaps fever reducers, as you mentioned. For the folks but we're sacrificing that epidemiological data there, and we have to understand that. The people who do need the test are in people for whom the positive or negative result will make a difference potentially in their management. Will they be a candidate for an experimental or compassionate use of an antiviral? Will they require more intensive treatment in the hospital? I think that's kind of where we're getting right now, where for young, otherwise healthy people, yeah, it might be nice to know yes or no. But another thing, Alex, is that sometimes if you're testing too early, you may miss it. It could be a false negative. So even if your test is negative, officials are saying, assume you probably have it and isolate.
Yeah, and again, complicated because the flu season is definitely out there, so hard to distinguish for some who might have a mild case of COVID-19. Faiqa, this question to you regarding the president who tweeted a bit earlier that the hydroxychloroquine and azithromycin taken together have a real chance to be one of the biggest game changers in the history of medicine. Hopefully, they will both be put in use immediately. Faiqa, do we know if they really work? And if it's too early to be sure, is it dangerous to make these statements?
So I'm just going to make a statement saying that at this time, there is no proven or approved treatment for treatment of this infection. The recommendations and the mainstay of treatment of this virus is just supportive care, which means giving oxygen, mechanical ventilation for those who need it, and taking measures to correct any abnormalities in the labs or electrolytes that we see in those patients who are severely affected by this virus. Having said that, there are some game changers. The ones that we have seen early promise with has been with this drug called chloroquine. This is a drug that was used for the treatment, that has been used for the treatment of malaria, and another drug called hydrochloroquine, which everybody may know is known as Plaquenil, used in the treatment of rheumatoid arthritis and for lupus. And early on in some studies, it has shown some promise that shows that this medication decreases the shedding of the virus and may decrease the number of days that you may be ill with this infection. There's still a lot that we need to learn and study and have some complete answers. Everything is just kind of early on, but we have some promise with this medication and we need to follow up on it for sure.
Okay. Dr. Azar and Faiqa Cheema, ladies, if you'll stand by with me, I would appreciate that. Everybody, we're keeping a very close eye on that White House Coronavirus Task Force briefing. We will take you there as soon as it gets underway. In the meantime, we are going to try to take a very short break here. We'll